And here we go with chapter 17, which is all about newborn nutrition. Babies only need breast milk, which is the preferred feeding choice, or formula for the first few months of life. No additional water or cereal, etc. is needed unless the mom and pediatrician agree for a medical reason to implement food ahead of the accepted schedule. Mothers usually make the decision to breastfeed long before they deliver their baby. It may be what worked with their other children, what their friends or family did or recommend. Discussion about the importance of breastfeeding needs to start long before delivery. At doctor visits or classes, the benefits of breastfeeding should be discussed. If mom does not want to breastfeed or cannot for health reasons, she should never be made to feel guilty about her choice. Formula options and proper amounts and preparation should be taught. Calorie needs are the highest in the first year of life. That is why it is important to not give water. They quench their thirst through feedings and need all the calories, not extra water. Breast milk and formula are 20 calories per ounce. Baby stomachs are about the size of a marble, very tiny. They will stretch and grow with the child through feedings. Imagine if you take your syringe and draw up 5 mils and put it in a cup. You probably won't even be able to hardly see it, right? There's not much there. Breast milk and colostrum are designed to give the best to the baby. Not a lot in quantity, but the quality is exactly what they need. People tend to feed formula in greater quantity because we think we need to. But babies are pretty smart, and they're going to spit it back up if we give them too much. By day 10, it is an amount that most adults think needs to be fed from day 1. Babies should eat around the clock, and they utilize the food efficiently. I love this picture showing the size of the stomach. Isn't that very interesting? Close proximity does not mean the same bed. Maybe in a crib next to mom's bed for ease of nighttime feedings until baby sleeps longer at night. With the increase in the push for rooming in for mom and babies, there was also an increase in babies sliding to the floor, sliding out of mom's arms. What do you think would be a good intervention to prevent this type of accident? What teaching should we be doing with parents prior to discharge regarding feedings and sleeping? Breast size does not matter in the ability to breastfeed or not. Surgery, including augmentation or reduction, can, if the nipple was removed and replaced, it can be a barrier to breastfeeding. So we need to make sure mom is able to lactate if she had that surgery. Nurses need to be aware of mom's situation and that baby is properly latched and receiving enough colostrum and milk. 1 wet diaper on day 1, 2 wet diapers on day 2, etc., up to 6 days. By day 6 to 8, we expect 6 wet diapers a day. Breastfed babies usually have bowel movements almost with every diaper change. Bottle-fed babies, their schedule can be a little different. Some babies go quite frequently, some go once every 3 days. As long as baby is comfortable, the abdomen isn't getting hard, the baby's not drawing their knees up to their belly and crying, these are signs that maybe they're having trouble with bowel movements or they have a bellyache. Frequent breastfeeding. Oh yes, it's going to be frequent. Supply and demand. The more baby eats, the more milk that is produced. A decrease in feeds will slow down production. Moms that return to work can keep their production up by pumping during the day. Letdown, which is the reflex that brings the milk to the nipple, can happen even if mom's out shopping without her baby and she hears another baby cry. Breast pads are an important thing to have or mom's whole shirt is going to be wet. Engorgement can be managed with pain meds, cabbage leaves tucked in the bra, and cool packs. Letdown can be helped by warmth. A warm, wet washcloth placed on the breast before baby's going to eat will help that if mom's having an issue with letdown. Look at all that good stuff in the breast milk. It really helps with the immune system in baby. Just the right proportions of macros that the baby needs. Lysosome helps get the gut flora started so that vitamin K shot will be effective. IgA is an antibody to help protect baby from viruses and bacteria. Bifidus factor is a probiotic. Antibodies to every cold, virus, etc. that mom has ever been exposed to are in that breast milk. Mother can provide breast milk in her absence by pumping. Formula can be used to supplement. Not a good reason to not start breastfeeding that mom needs to be there. Mom should be educated on the benefits to her baby and to her in order to make an educated decision regarding breastfeeding. She should never feel coerced or feel like a bad mom for choosing formula. HIV positive women should not breastfeed, and there are other rare reasons for not breastfeeding. Galactosemia will be diagnosed with the state metabolic screen, and symptoms will appear usually before the test even comes back. They will need to avoid galactose and lactose for a lifetime. Mom with TB can pump the milk and it can be fed to the baby, but until she has been on medication for a while and isn't active TB, she should not be in the same room with the baby. Active herpes lesions on the body, anywhere, on the chest, on the nipples, yes, this can be a thing. Mom should definitely not be holding baby. Some babies get it and some need some coaching. It's not an automatic thing. Babies have an inborn desire to eat, but they may have some trouble latching on. It can be a problem with their jaw, with their mouth. Maybe their mouths don't open wide enough for mom's nipples. Mom can get sore, cracked, bleeding nipples, which we learned can lead to mastitis, right? Plus it's painful. So we need to make sure proper latch is achieved. Listen and watch for swallowing. Lactation consultants are usually available in most hospital settings. Moms can get overwhelmed, feel very inadequate, and become frustrated quickly and just want to jump to the bottle. Patience is truly required. Moms that have babies in the NICU can pump and take their milk to their baby, and this often makes them feel like they are truly a part of the baby's care. Doctors can get concerned if babies lose 10% of their weight. You might see 7% in your book, but I want you guys to remember 10. Bottle or breastfeeding, doesn't matter. They may even keep them from going home if they've lost that much weight by discharge day. We need to check for signs and symptoms of dehydration also. So in a baby, what do you think signs and symptoms of dehydration are? Dry mouth, the sunken fontanelle, skin, same things as an adult, but we do have that fontanelle to check with. They can get very lethargic if they're not getting enough. They can develop a weak cry because they're hungry and they're going to be crying, but they're weak. Mom may need help. What if her nipples are flat or inverted? She can still breastfeed. She can use a nipple shield, which draws the nipples out. She wears that in between feedings. She can pump her milk if she absolutely can't get baby to latch on. Or, I'm sorry, a nipple shield. She can wear that, and that gives her a nipple. There are holes in it, and the milk will flow right through. There's a nipple, something else. That is the nipple shell is what I was thinking of. She can put that in her bra in between feedings, and it kind of helps to draw the nipple out. Mom can use lanolin. She can actually leave breast milk on the nipples when baby's done and let it dry. That will help soothe the nipples. She shouldn't use any harsh soap. She can change the baby's position, make sure the latch is correct. What is nipple confusion and how can it be prevented? You might want to look that up. Here is a question. Here is an answer. Formula feeding. Babies should not have straight up cow's milk until they are 1 year of age. It is just not suitable for infants. Formulas keep improving to mimic breast milk. With every nutrient discovered, they figure out how to put it in the formula. When mixing the formula, the water source must be acceptable. If parents concerned about their water supply, they can boil the water or buy bottled water. Bottle feeding is a great experience for mother and baby or father and baby. We need to support and educate bottle feeding parents. Hand washing is important for the prep of bottles and also prior to breastfeeding. We must make sure parents mix the formula correctly so the strength is accurate. It doesn't always have to be heated. Babies can drink it at room temperature, but you should never reuse formula. Once the bottle has touched the baby's mouth, bacteria will start to grow and we must discard it within an hour. Never prop a bottle. Make sure the nipple is full of formula so baby's not swallowing a bunch of air. Burp when needed. Baby may take more after burping, but do not ever force feed the infant. Never use a microwave to warm formula or breast milk. It kills some of the good stuff in the breast milk and it can heat unevenly and the formula or the breast milk can have hot spots. Soy or other types of infant formula should only be used after a discussion with the pediatrician. It is not the best choice for babies. Like I said, no microwave, no propping. Proper preparation is important. Do not reuse bottles once they've touched the baby's mouth after an hour. Don't put more food in the bottle than you think your baby's going to eat. You can always add more to it, but you don't want to waste it. It is expensive. Warning signs of bottle feeding problems. Why are these dangerous ideas, you guys? Here is a question, and here is an answer. You may want to watch that. I may have a test question where you're going to be figuring that out.